with your hosts, Stephen Edwards and Maureen Edwards.
Good morning.
Good morning.
I'm so glad we can talk this morning. And everybody to kind of meet you. Want to introduce yourself, Stephen?
Of course. As you mentioned, my name is Stephen. I am a child and youth worker. I work in the school board and in the shelter system. So I have a lot of experience working with a lot of different types of clients. And some of my work includes behavioral management, life skills intervention, and really just working one-to-one and in group settings to help clients reach their goals, whatever that may be. It could vary very differently depending on their cognitive function levels and where they are in their life. But the overall goal is to help them obtain something that they don't have, help them reach a goal that they're trying to work towards, or develop something that they can't work towards.
That's fascinating. Stephen, how did you stumble into this area of work?
I would say accidentally. I did have a little bit of guidance growing up by watching my mom. She did a lot of youth outreach work, so I got to see some of that firsthand. And while I didn't know that's something that I wanted to do until I was much older, when I was looking into different programs for college and university, it is something that kind of stuck out to me. And after I began doing the work, that's when I really realized how capable I am at this kind of thing. And I've just been going with it since.
Like when you talk about it, it's like, wow, behaviorally challenged children and, very high needs population, right? Working in shelters and everything. What keeps you, like, what turns you on about that?
One of the things that definitely sticks out is every day is a little different. You never exactly know what you're gonna walk into, which some people might get stressed out by. But I'm more stressed out by walking into the same thing every day. And one of the things I really appreciate about this line of work is that Monday and Tuesday and Wednesday and Thursday and Friday could all look different. And even if maybe it's looking like a typical day, I have the flexibility to create a program with the youth or work on a specific topic that I'm interested in or that I think they might be. So even on days that are a little bit more quiet, a little more calm, I can still put a little spin on it and make it educational, make it fun for everyone, myself included.
Do you get attached to the kids?
Yes, of course. I definitely build strong bonds with them. I've worked with children from the age of 2 up until the age of 25, and that attachment differs depending on the age. The relationship changes depending on the age and the context of why we're meeting. But I definitely build close bonds with people, and I'm always open for, seeing them after service has ended, just to, catch up or, hear what's going on in their life. That doesn't limit the capacity you have to care for them.
When working with children, whether they're young or youth, I'm thinking maybe the parents are also like a client or part.
Parents are a big part of the picture, for sure. It depends on, again, the relationship of the client I have with them and where I'm working. I don't see many parents when I'm working with youth in the shelter system. Most of them have already lost that relationship, or if they have it, it's very strenuous and they don't really, so I don't have that opportunity. But with a lot of the other youth, there's definitely a strong need to communicate for the parents, especially when they're living at home, because most of the work can either be reinforced or undone. And if the parents are willing to, take you up on your recommendations or have a conversation and figure out what is the best strategy or best plan to, work on this behavior or help them achieve this goal, or even just basic things on how to, communicate with them or get the kids to open up, whatever it is, the parents are definitely a very important part of the picture. And if you neglect that, you're not going to achieve nearly the same results.
So are you doing kind of like family group counseling kind of thing, or coaching? What would you call it?
It would be more like having meetings from time to time and talking about the service that has been provided, what goals they would like to see, the parents would like to see out of their children, and how we can both work separately but together to achieve that goal. So, for example, he's 18 years old, but cognitively functions as a 2-year-old, 1 to 2-year-old. So one of the things that his mom would love to see at home is for him to be able to express when he needs to go to the washroom. That's a very difficult task for the youth, despite being 18 years old. It's something that either hasn't been worked on more or hasn't been worked on hard enough over the years and reinforced, or it's just come with a lot of setbacks. It's also an achievable goal to get him out of it. So while I'm not necessarily communicating with mom every day, I might touch base every few months and say, this is kind of what we're working on.
What age groups are you typically working with?
Right now, I'm working with older youth between the age of 14 to 24.
Okay. What's that like?
It's fun. I enjoy that age group because I get to talk to them almost as they're a peer. Pet therapy can be very beneficial. Actually, I know the school systems are starting to utilize that a little bit more. Just the other week for exams, they brought in some service dogs and let children of all types of, cognitive functions, whether it's the regular kids in the school or children in the DD programs, have a chance to go and meet these dogs. And the purpose was to help with stress and anxiety levels in a high stress, anxious time, exam time. So even though the population I'm currently working with isn't doing exams, it can still be a very fun and relaxing experience for them to go and meet animals that are well trained and calm, just to interact with them and relax. And, it's not something that everyone gets to do. If you don't have a pet at home, there's a good chance you're not going to ever interact with that specific animal. And animals can be very therapeutic in a lot of ways.
When you were just talking about anxiety, with youth or kids in general, what sort of are the big kind of the more common mental health things that you're running into with this population?
The DD population specifically?
Well, and I think maybe you have to define DD.
Yes, absolutely. DD would stand for developmental disability or developmental delay. And it refers to a wide range of people who have some type of either diagnosis or chromosomal issue that creates it more difficult for them to learn. So people with DD are generally much lower functioning cognitively than the average population.
Right.
They may still be capable of going to college and working in trades and living a productive, quote unquote, normal life.
With that population, what are the more common sort of psychological things that you might deal with, whether it be anxiety or depression or whatever? What are you seeing?
So it's definitely a little harder to define with that population because they aren't able to necessarily express themselves in a way that others are going to be able to understand. So I might be able to go up to you and say, I'm feeling very depressed today. I'm not feeling happy, or I'm feeling very anxious about this test I have to take, or this new job I'm going to start. We could have a conversation about that. You could give me tips and we can create a solution, or at least, set out specific things I could do in order to ease the anxiety, or, to feel a little happier on a long-term basis. So with the population I work with, DD, they probably aren't able to verbally say, I'm feeling sad or I'm feeling anxious. It's going to show in different ways. And that could be more often than not behavioral. So they run into a lot of issues because they're not able to express themselves normally. They react in a, maybe an aggressive way. That could be throwing a chair when they're angry, or hitting someone, or running away. It really depends based on that child, how they're functioning. But the main thing that you run into is behavioral issues, and a lot of the work revolves around combating that by giving them strategies to use when they're starting to feel that way. You need to, as the worker, identify when you notice their behavior is shifting, and that's when you need to intervene and either do something yourself with them to de-escalate the situation, remove them from the situation that is giving them anxiety or stress or anger. And afterwards, you really start working on what they can do when they're starting to feel like this. Maybe that's using a fidget toy to calm them down, or maybe that's leaving the classroom and walking through the halls. Maybe that's going for a jog or playing basketball. It really depends on their interests and what's going to work specifically in that moment, what's realistic, because not everything you can do when you're feeling anxious, right? You can't necessarily run home. So you need to figure out something you can do here to solve the problem. And a lot of it comes back to the worker, figuring out what is going on and using a trial and error type approach, because there might be 100 tools in the chest and every tool might be valid, but maybe only one or two tools are going to work with that individual. So it's a lot of trial and error until you figure out, this is something that's beneficial for them, or this had this result. And then you take that information you gather and you start putting it into a longer plan.
When you were talking about that, what came to mind is, like for myself in my practice, dealing with a lot of people with either a traumatic brain injury or concussion, things like that. One of the main things that seems to be prevalent is anger or raging. And when you were talking about that sort of unpredictable, all of a sudden there's like an outburst or something, that came to mind. How prevalent is the anger rage in the kids that you're working with, especially the DD?
I think anger and rage is very prevalent in all of us. Maybe more so in the DD population, because they're not able to express it in the same way. But I think it's definitely something we all need to work on. And if you don't work on it from a young age, it really starts to show as you get older in your relationships, whether that's friendships or family or love relationships. A lot of the time it comes back to you being unable to self-regulate your emotions and understand where someone else is coming from.
Sometimes having a secure attachment can really help a person socialize in a quote-unquote more normal way or a way that builds relationships?
I would agree. Attachment is very important, and you really see it more as people age. And a lot of it always comes back to childhood trauma or how they were raised, what was missing, what was prevalent. And the more risk factors you have, the more likelihood you are to have problems with your relationships. And it's very interesting how it all ends up reverting back to the childhood.
So does early intervention and does child and youth coaching and counseling and mentoring and behavioral management with kids, does it work?
Absolutely. I've seen remarkable shifts in behavior, in outlooks on life, in abilities to achieve things that they weren't able to do before because they would get too angry before they could even do it, or too anxious they wouldn't even start something. It's very important. Early intervention is always great. It's very necessary, but what we really need is a continuum of care, because while you can have a worker for, your first 6-7 years of your life, and that's going to be very beneficial, as I said earlier, if you're not getting that same care and attention and love and support at home, a lot of that work is going to get undone. And you really just need a streamline of care, because if you're not getting it, then you really start to see a lot of attachment issues. And then when you have attachment issues, you see a lot of issues with relationships and anger and depression and anxiety. Everything seems to stem from not getting the love and attention that you require and discipline that you require from a young age, and all the way through your developmental years, which go up until nearly 30.
Thank you, Stephen.
Thank you, Maureen. It was great being on. Take care.